Hey guys, Dr. J here, physical therapist. I'm here to talk about headache, neck, and jaw mobility today. So you might be thinking that we might be doing a lot of like jaw movements, such as like opening, protrusion, moving the jaw in different ways. I think there's a lot of scopes and a lot of different ways to treat jaw and headache mobility, but everything is in sync. So head, shoulder, thoracic spine, all of that comes into play. I've said it before how when I deal with jaw, a lot of times you could look at the jaw motion, everything like that. You don't need to necessarily do any manual therapy to the jaw. A lot of times, if you just treat the head, you treat the thoracic spine, you get other areas moving, the jaw pain goes away on its own. And jaw pain is also a result of stress and everything too, and some of the habits that we have. So, couple things that I have. Really, I just have a foam roll, and you guys can use any size foam roll, anything that's 6 inches in diameter, using a foam roll, and I'll also be using this towel as well. Okay, so going into some of the towel exercises. All right, so a towel can be used in many different ways because a towel can assist with range of motion of my neck, but a towel can also be used again as resistance because towels, they don't comply. So a lot of times you can push into a towel, it's like an immovable object, and you can actually load your neck and actually to get rid of headaches. So going through a couple. So the first thing I'll do is called cervical retraction. Okay, if you get your towel kind of on the top of your occiput, there's a couple things that you can do. One is you can lock it onto your occiput. Okay, and then once you lock it onto your occiput, I'm actually going to chin tuck. So I'm going to put the tongue on the roof of my mouth, behind my teeth. I'm going to keep my lips closed. Don't clench your teeth. Okay, that can increase headaches. So you're going to do that from this position. If you can see, I'm going to push into the towel, and my arms are actually pulling just slightly forward. Don't pull too hard, right? You don't want to overcome your neck muscles, but I'm going to push in, and as I go into the chin tuck, my arms are just meeting the resistance of my neck. Okay, so once you meet the resistance, there shouldn't be any movements, and that would be considered an isometric hold. And then relax. I'm going to go into a forward head posture, push into again, meet the resistance. If I want to push a little bit further back, push a little bit harder, that's loading the neck. And I'm just going to repeat that just 3 to 5 times, guys. 3 to 5 times, 5 to 10 seconds. Doesn't take too much time out of your day. All right. Relax the neck, give it a little break, especially if it's a little sore, and then go one more time. Push. Hold this one for 10. And then relax. Okay. So the other things that we can introduce is snags. Okay, cervical snags. Okay, they stand for sustained apophyseal glides. Okay, so basically you're using a towel. They're using a towel or some sort of object to move the neck into different positions. Versus if you're just doing range of motion, you wouldn't be able to go as far. So you can call that. It's kind of like active assisted motions, but it's also like a joint mobilization that you can do for yourself without any manual therapy or anybody else doing it for you. Okay, so what I like to do here is I like to grab onto the back of my occiput. So we also have that little bit of a curve at the back of our neck. So you can actually pull, you kind of like lock onto the occiput and you can pull up. So I'm actually pulling up in a diagonal angle. And as I'm pulling up, I'm going to look up towards the ceiling, and I continue with that upward pressure and come back down. So I'm going to lock into the occiput again, pull up and kind of diagonal towards the ceiling, and 2. We just do about 10 to 12 times. 3, 4. Continue to maintain that pressure with the towel. 5, 6, 7, 8, 9. There'll go one last one. 10. Okay. So then sometimes prove it to yourself. Does extension feel better? Extension to me feels completely free, no stiffness at all. Okay, and that was working strictly on extension. Now, if you're having stiffness with rotation, you can also do cervical rotation snags. Okay, so you can lock onto here. And so basically, if I want to improve right rotation, you could test it right now if you guys want to, guys. So like left rotation, test out right rotation. Right rotation actually feels better. Left feels maybe a little bit stiff. Okay, so I'll show you how to improve left rotation. You're going to hook the towel onto your left side, okay? You're gonna switch hands, watch. It takes a little technique, okay? I'm gonna grab, even as on the left side, I'm grabbing it with my right arm and I'm pulling down towards my right waist, okay? Once I pull down towards my right waist, I have a little bit of a lock on the left side of my neck. Now from here, I'm gonna lock onto the top of my head, watch out for your ears, and I'm going to pull in one. So I'm actually pulling, as you can see, this left arm is pulling my neck into left rotation, 2, 3. So there's a lot of counter forces. Keep that hold down and down towards your right waist. This one assists with the left rotation. 4, 5, 6, 7, 8, 9, 10. Okay? You want to switch sides, go with right rotation so you can switch hands, right? Right side, left arm. Okay, left arm pulls down into the side. This one locks onto the side of your temple. Okay, sustain that pressure. Pull to the right. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, guys. So hopefully, after you do that, there's actually, if anything, if the range of motion hasn't improved, but for me, if range of motion, I feel like I'm going a little bit further, but I actually feel like there's no resistance at all. So I can actually go as far as I want to without any stiffness at all. Same thing with my right rotation. Easy fixes, okay? Easy fixes are going to be more permanent though if you don't just do it once a day, but if you supply that same type of load throughout the day, you can create some permanent change that way, okay? So those are some of the towel exercises. Now, if we use the foam roll, we can combine foam roll exercises and we can also combine the towel at the same time, okay? So let me just make sure that I can see myself. So I'm actually going to get to the floor. I'm going to put the towel down, and you guys have seen this before, but I will always start off with just foam rolling and make sure my upper back and between my shoulder blades feels better. So I'm going to support my head, especially for those of you that have headaches. Support the head, relax the head into your hands, lift up your butt a little bit, and you're just going to roll first. Okay, start off with about 15 to 30 seconds, just rolling back and forth, keeping your body parallel with the floor. Usually feels pretty good. At the end of the day, midday break, rolling out the thoracic spine and everything that's stiff between the shoulder blades. Now from here, I'm going to drop the butt down, find a spot that's stiff, roll right past it, and you're going to go into some extension. Okay? Usually just about 5 to 10 times extension. Okay, keeping the abs braced as you roll back. 2, 3, 4, and 5. Okay, now I'm going to go to a little bit of flexion. I like to pull my elbows into and almost like pull my elbow in front of my nose. That way it's going to tighten up all the muscles in the back, so you're going to get a better stretch. You're going to pull the elbows forward, and you're going to flex. Okay, I'm trying to get my elbows towards my knees. 2, flex again. 3, 4, and 5. Okay, and relax. So let's just take a little bit of break there. Now, here's the thing though, especially if you're having any headaches or jaw pain, this is actually where you can add in the towel as well as use the foam roll at the same time. Okay, so I'm going to lock onto my mid back again, lock that foam roll right there. The towel, now I'm going to use the towel to support my head. So now I'm going to do that. Okay, I'm going to wrap the towel. We're going to go into that same parallel position, okay? And now as I'm rolling, what I can do is I can chin tuck into the towel at the same time. Chin tuck and roll. So I'm maintaining that chin tuck. I'm activating my neck muscles as I'm foam rolling. Okay, so the same idea. Then again, find the stiff spots, drop the butt down, keep the abs braced. I'm going to push now into the towel. Watch this. The width extension, I'm also going to chin tuck. So I'm going to chin tuck into the towel and then go into extension. Chin tuck into the towel, extension. And let's repeat that 5, 6 more times. Towel, extend, but find a different spot. All right. So same thing goes. I can actually pull my head into retraction. So I'm going to chin tuck again, and I can do a little bit of flexion. So I'm going to first push into my head, chin tuck into the towel, then flex. Chin tuck, flex. You're basically doing a chin tuck, then you're doing a sit-up. Chin tuck, sit up. Chin tuck, sit up. And one more time, chin tuck, sit up. Right. Okay. So besides that, okay, the last exercises that I'm going to do are just a little bit of rotation. Okay. We need to get a little bit of that rotation throughout the upper back in order to improve shoulder mobility as well as neck rotation mobility. And getting these areas to move will also alleviate neck soreness, headaches, as well as jaw pain. Okay. So I'm going to do a thread the needle exercise. So you're going to put the foam roll on one side of your body. You're going to go onto your hands and knees. So the first thing I'm going to do is I'm going to put my hand through. This is called thread the needle thoracic rotation. I'm going to sit back a little bit, sit my butt back towards my heels. I'm going to rotate through and use that foam roll to kind of guide me further. Okay, and then I'm going to reach up. 1, reach through, push that foam roll out, roll that foam roll towards you. 2, 3. Okay, and don't just go partial range. Whatever you can tolerate. You can tolerate getting that foam roll as far as you can, and then reach out as high as you can and wring out your spine. Increase that range of motion, improve that mobility, get better results. 8 and 10. Okay, so now I'm going to do the opposite side. Put the foam roll on that right side of your body now. Right hand down. We're going to rotate through and rotate up. Three. This is 4. Just going to go up to 8 for this one. 5, 6, 7, and 8. All right. Cool. So if you wanted to end the exercise just with a little bit of randomized movement, okay, getting yourself into that quadruped position, head has to work against gravity. So getting your spine to kind of side bend, to rotate, or even to flex and extend, that's what's going to get your body moving, get you out of pain as fast as possible. Okay, so easy stuff. Okay, we've seen cat camels. I'm sure a lot of people have seen this before. Just rotating the pelvis under, arching your back. Okay, I call these tail wags. If you see what I'm doing, tail wags is just expanding one rib cage, shifting your butt side to side, and side bending through the rib cage and the lower back. Easy exercises to do throughout the day. All right, cool. So just to recap some of the things that we did, we worked on a lot of different towel exercises, how to improve range of motion without the need for any manual therapy, any hands-on care. Okay, so this is a towel, that's all you need. All you need is a foam roll too. If you guys have any questions at all, this was a very quick training, but very effective training. I feel like $1 million now. Neck mobility is great. So yeah, if you guys have any questions, just throw them into the group. Cool.